what mental or psychological triggers for weight gain are there. And Missy has another great example of this too, because she shares how she battles with anxiety. Actually, in 2019, she shared in an article that right before the 2015 Super Bowl performance, y'all remember that? She did a great
Mhm.
job. Yep, she came out with Katy Perry, but she was hospitalized for an anxiety attack. And so this
Mm.
is something she's dealt with on and on. So anxiety, if people aren't familiar with it, it's a then we say it's a mental health condition, but mental health is physical health is health. Like health is health, right? You know what I'm saying?
That's
Like it
right.
affects them. It may start in the mind, but it has physical symptoms as well. But anyhow, and we're talking about the weight loss part of it. So, but some of the symptoms you might see are excessive worrying, overthinking, fear, and it can be caused by emotions or by even by medical conditions. And I want to say that thyroid disease in and of itself can cause anxiety. And so there again, we have that body, mind, spirit connection, right? Where it's not just a psychological thing, but it's actually there's an interplay between what's going on in the body and what's going on in the mind. And when it comes to your weight, high stress levels can trigger anxiety, and anxiety can trigger stress. And stress is like, if you want to fuel your fat cells, if you want to fuel your fat, if you want to like, I just want to see how much weight I can get, just like stay stressed out. Let your stress level, your cortisol level be high for like a week, 2 weeks. I assure you, for most people, because there's always going to be that one, there's always that person. I lose weight when I'm stressed. Okay, great, that's your story. But for most people, high levels of untreated stress are going to be associated with weight gain. And that's because, again, we're talking about inflammation, we're talking about that high cortisol level. And then also we're talking about like your insulin sensitivity, which we talked about in the diabetes talk earlier this week. So it's really important to control that stress level. And I just actually